Media Production presents Gypsy Soul, your one-stop shop for letting out your inner gypsy. Join Denise Marsh as she brings on a variety of guests to share their artistic vision with the world.
Happy Thursday, everyone, and welcome back to Gypsy Soul. I hope everyone's having a great week. So I don't know about you, but if you've ever had vertigo, it is absolutely horrible. Okay? The room spins, you get up suddenly, and you almost don't know where you are. And so 2 weeks ago, I had vertigo, and I went to my guest, and he was actually able to cure it. So my guest is very special. Not only is he a guest, he's also a sponsor for this show. And after a short break, commercial break, I will be introducing him to you. His name is Dr. Max Cohen. He is the chiropractor and director of Max Health Chiropractic in Wellington, Florida. And you will be getting a hands-on experience with him when we come back from a short commercial break. See you soon.
Max Health Chiropractic, located in the heart of Wellington, Florida, is the area's premier chiropractic office. Dr. Max Cohen and our highly skilled team want to be your natural health care provider. Everyone should be able to move, work, and play at their best, regardless of age. We offer a wide range of advanced chiropractic techniques and therapies to eliminate pain, enhance performance, and improve mobility and function. Set your appointment with Max Health Chiropractic today.
Hi, Dr. Max.
Hello.
Hi. You got to see yourself in the commercial. Was that exciting?
Yeah, it was a really good commercial.
Was it weird?
No, it was cool though.
Good.
Yeah.
I know. So now you're famous and you know. So when did you realize that you wanted to be a chiropractor?
When did I realize I wanted to be a chiropractor? Well, it was, I was actually trying everything I could when I was in school not to be a chiropractor. I was. My father's a chiropractor and my grandfather's a chiropractor, and I grew up with chiropractic. I always knew what it was. I knew the benefits of it, and I couldn't, imagine having myself or my family without chiropractic. So I always knew I was going to have it, but I didn't know if I wanted to be one. And it was during the time when my father was at his 25-year class reunion, and I got to join him in his reunion, and I was honored to take a tour of the college that he went to, and one of the first places that they took us to was the dissection lab. Yeah.
No frogs though, right?
No frogs, actually.
I was always afraid of that.
Human parts, actually, and that's what I was really blown away about.
Live human parts?
No, yeah, well, they were live. They were.
Oh,
yeah,
I'm like,
they were cadavers. They were cadavers.
Okay.
But one of the professors asked the question, "What is the number one thing that chiropractors work on?" And the answer to that question is inside this bucket, and there's a white bucket. And I remember this, and he said, everybody was saying the back, the spine, the neck, the joints, the bones, right? And wrong. And inside that bucket, he picks out a brain, and attached to that brain was a spinal cord and all the nerve filaments attached to it. And he just picked it right up out of that bucket, and he said, it's the central nervous system.
I would have passed out.
And then he goes, do you want to touch it? And he turned it right over to me, and I actually touched it, right? And that's when he turned and said to me that you would be a good student at this school, at this college, because most people would steer away and not want to touch it, like you just said, right? And so I told my father, I was like, man, I was really intrigued by this school, and they not only showed us about, the cadavers, but they showed us, the different parts of the joints and the bones and the things that we touch or palpate. We learned about that. And I was just interested in it. And my father then said, if you're, what's holding you back? And I said, number one, I don't know if I want to touch people. I was really good at math and really good at engineering and things like that. I had that interest, but I didn't know if I actually wanted to apply that with my hands. And so he taught me about massage therapy. He told me, try massage therapy. It's a year of school, and then afterwards, if you like it, you can continue on, and if you don't like it, at least you have, a job that you can,
a backup.
Yeah, a backup, right? It was my first week of massage school. That is when I decided to be a chiropractor. Yeah, because
Didn't like the massage thing?
well, I did. I loved it. I actually the worst day of massage school was the last day of massage school because I loved it so much, and every day we got to practice on each other. So.
Oh, that's nice.
Yeah,
I always
right?
thought you just practiced on a dummy.
No,
I didn't know it was a real person.
no. We practiced. Well, most of us were dummies, but we still practice on each other, right?
I love it.
Yeah, I absolutely loved it when you can apply intention to your touch and influence a change in someone's health. That's a big deal, and it really didn't manifest at that, before that until that time,
So it's a nice bridge. It's almost like you learn, I think it's called reflexology, right? I remember studying it. I remember I used to, not as good at massages as you probably are, but I remember studying how there's different parts of your body that control other parts of your body.
I was the biggest skeptic of reflexology until I had it done on me during massage school. And it was an hour. I had one person on my left foot and another person on my right foot for 60 minutes.
Wow.
And I
want to do that.
I don't want to get too graphic, but I had to rush to the bathroom. And
because they touch pressure points?
Oh, yeah, through my digestive, through the large intestine.
It's true.
Oh, yeah.
Yeah.
I know. I definitely believe in it.
That's I remember when, because I get carpal tunnel sometimes, and I watched something on YouTube, and they showed you how to flex each finger so it'd go away. And these things work.
Oh, yeah.
They really work. So back to the next thing, which is a perfect piggyback for us.
What you got?
There's a lot of skeptics to the art of, and I call it an art of being a chiropractor because you are an artist.
Okay.
I mean, you're putting things together. You're almost putting back missing pieces together.
Yeah.
You're helping people. You're sort of like you have a canvas and you're like creating a piece of art. You're putting people back together. You're making them feel good about themselves. That's art to me. So a lot of people are skeptical of this kind of healing, I mean, not that they say it's witchcraft, but some people call it witchy, or it doesn't work, or you could get really hurt and you could get sued. And I used to think that before I started to go, and I started to go to you, and now I'm never going to think that again, and I will tell people out of that thinking. So why do you think people talk like that? Can you speak to that?
Yeah. Well, I mean, there's a skeptic in anything, right? I mean, not everybody's a fan of toothpaste. Right? I tell my kids, if you don't believe me, you just tell them, ask them. But, I think a lot of it comes with, there was back a long time ago when medicine was even being discovered, back in the late 1800s. That's when chiropractic was really discovered. And it was discovered by a gentleman, D.D. Palmer. He was a magnetic healer. They say, magnetic healer, and that's where the idea of witchcraft or this sort of esoteric healing sort of came from. But he was more than just a magnetic healer. He was also an anatomist. He studied cadavers, he studied science, but this is also before medicine. Understand that back in the late 1800s, medicine wasn't even developed. I don't believe it was developed until like the late 30s or so. I could be wrong, but it was in the 1900s when medicine came around.
So the chiropractic thing came first?
Yeah, and it came first, and so did homeopathy, and in a lot of the science, and you said art, but also chiropractic is founded with science and philosophy. And it's founded by the premise of the body healing itself, And when you said earlier how I healed you from the vertigo, actually I refuse to accept that. I removed interference. Your body healed itself. All right. Yeah. And so
I gave you too much credit.
Gave me too much credit,
Okay.
but thank you.
You're welcome.
But I don't know why people are skeptic. I do know that chiropractic is growing like crazy. We're now the second largest healing profession in the United States.
Because people are finding it works.
Yeah, I mean, I have doctors now. When my father is a chiropractor, but back in the 80s, medical doctors were, really, frowning upon chiropractic. But now I have doctors that are my patients. I actually treat their families as well. And I treat their patients. I see many different types of doctors. I have OBGYNs, pediatricians. I have primary doctors. I even treat an orthopedic surgeon in my office. So, I mean.
So you have good standing. 5 stars.
Yeah. Yeah.
They trust you. That must make
customer
you feel
service
good.
is big.
Yeah.
Mm-hmm.
That must make you feel good that you're so trusted. And from the commercial, we could see that there's some people in your family on the commercial. Is it a family business?
It's a family business. Yep. We started it 10 years ago. My wife and I, and you saw my youngest son in that video. Both my kids were adjusted at birth. Yeah. There's a lot of trauma during childbirth, and so when misalignments happen, especially in the upper cervical spine, it can predispose us not only to physical problems but also health issues in the future. So I make sure that they're free of that.
I'm glad that you brought that up because we are going to go to a short commercial break. And when we come back, Dr. Max, I would love for you to show us some of the tools that you use
Absolutely.
in the office and to tell us more about the spine and all of this interesting stuff. And I'm glad that it's not, that these are cadavers. That's all I can say.
Oh,
So
thank
we
you.
will see you in a few minutes. Hang tight.
Max Health Chiropractic, located in the heart of Wellington, Florida, is the area's premier chiropractic office. Dr. Max Cohen and our highly skilled team want to be your natural healthcare provider. Everyone should be able to move, work, and play at their best, regardless of age. We offer a wide range of advanced chiropractic techniques and therapies to eliminate pain, enhance performance, and improve mobility and function. Set your appointment with Max Health Chiropractic today.
And we're back. And hopefully you're still there. So Dr. Max, tell us a little bit more about the tools that you use.
Okay, well, the main tool that we use as chiropractors is our hands, you know, and going back sort of to your previous question, why are so many people skeptic? I don't know if we're dealing with so much skepticism as we are fear, you know, and you know, the fear lies with, you know, not being able to really see the problem, but feeling it. And when people have back pain, it's not only pain that they're feeling, it's limitation to their life. It can stop them, right? And not being able to see that problem, it raises a lot of fear. And sometimes when patients reference the problem in their spine as being the cause of their pain, they'll say, my back is out. You know what I mean?
Everyone thinks it's the back.
Right, and actually that's not the case. And so what happens is if you guys can see what I have here, this is a model of the spine. These are two individual bones of the spine called vertebrae. And then when I turn this over, this is what I say, this is where all the action occurs. This is where all the movement happens. And what actually is happening is that these joints get stuck in place. They just lose movement. And when they get stuck in place like that, it causes inflammation in those joints, and it causes a lot of pain and also pressure on the nerves that come out. What's not happening though is the vertebrae actually shifting out of place. You know, when you see it go like that or completely out of alignment like this, that's not a patient in my office, that's a patient in the hospital. And so that's not what's happening. So when patients come in with back pain, it's not because their spine is out of place, and there's nothing that is out of place that I'm moving back into place. That's actually not what's happening. What's happening is you have little joints that get stuck, and as a chiropractor, I use my hands and understand and evaluate that malposition, and I just apply a small little pressure so that space can be gapped and the joint can then move much better, more free, and nutrients can be provided to the disc, and pressure is removed off the nerve, and the body can naturally heal itself. So, and one of the tools that I use besides just my hands are these little spring-held instruments called an activator. There's a spring on the inside of here, and there's a pressure that's created when I pull back this handle, and there's different numbers on the side of here. I don't know if you guys can see that, but these numbers indicate how much pounds of pressure that this activator can actually move. So if I go ahead and I move it to a 1, Denise, let me see your hand. Mm-hmm. All right. Tell me, how does this feel?
Fine.
Really,
barely feel it.
Barely feel
Yeah.
it, right? That was 4 pounds of pressure.
I barely felt it at all.
That can actually, that's 4 pounds of pressure that you felt into your hand. Now, if I go ahead and I move this to the higher setting, to a number 4, now tell me how you feel. It's a little bit more, right?
Yeah, but not hurtful. It doesn't hurt. No
right?
pain. No
that
pain
was
at all.
24 pounds of pressure. Yeah, so.
It doesn't feel like 24 pounds.
I know, it doesn't, right? And the idea behind this instrument is not to move the bone. It actually doesn't do that at all right? What it does is something that is inside of these joints is something called a mechanoreceptor. And I refer it to many times as a cell phone tower. Okay? It sends and receives information. When your joints move, your joints are feeding your brain with movement neurology that's essential for you to heal. all right? Without that, then there's a stress response in the brain, there's inflammation that accumulates, and it can affect your health in other ways. Even your digestion can be affected.
So the brain is like the main tower?
Yeah, it's the main tower, right?
I got it.
It's
It's
what
a good
receives
analogy.
and sends information. These little mechanoreceptors are inside the joints, and when these joints get stuck in place, what happens is what I'll do is I'll use the activator to stimulate the actual mechanoreceptor, having a neurological change on the body, so the body can move better and heal faster.
And this little thing does
That's it.
magic.
Yeah, it doesn't hurt at all. And this one right here is something I use for babies. I actually adjust little babies. As soon as a baby is born through the birth canal, there's a lot of trauma through that process. And so when we find areas of restriction or misalignment, what we'll do is we'll apply a little application.
Can I feel the pressure on that?
Yeah,
I'm
absolutely.
curious how that feels.
Yep, that's
Oh,
all it is.
Even less pressure?
Yeah, even less than that. You hardly feel it. And I really love adjusting babies because, like skeptics, they talk back. Babies don't. And it's really fun when a baby's crying and I can make that adjustment and they stop right
I've
there.
heard of the babies crying at the office. Yeah, and they stop.
Yeah.
They do stop. I'm like,
Yeah.
what happened?
I know, and they walk better. They have better coordination, balance. It's
Are the parents
incredible.
afraid when they come in with a baby?
Yeah,
Like,
but
are they scared?
Yeah, but that's
Yeah.
why we educate patients in terms of what's going on, how we're going to correct it. I never do anything that somebody doesn't want, clearly, and I would never recommend anything that someone doesn't need either.
How young are the babies that come in?
I've adjusted both my kids as soon as they were born.
How did you know how did you know they needed to be adjusted?
Okay, so I feel there's certain things that we're trained as chiropractors to feel for, and we know it's normal, we know it's not, and when something's not feeling right, that's a good time to make that correction.
So you were in the delivery room, obviously.
I was,
the whole
yeah,
time,
yep,
watching,
yep.
monitoring.
Yeah,
Oh,
yeah.
That came in handy.
I know.
Literally, no pun intended.
I know.
So, I know that you have a lot of great things to say about the office and the business. And can you tell us how people could get in contact with you? They were interested in coming to your office
Yeah.
and booking a session with you?
Well, they can make a call or they can go online. All right. Our website's maxhealthchiropractic.com. We're really passionate about helping as many people as possible obtain natural health. And something else we're also really passionate for is raising money for the Kids Cancer Foundation. Kids Cancer Foundation is a local charity in our community, Wellington, Royal Palm Beach. And it's an organization that actually helps families whose children have cancer. And what's really, if I don't mind just taking a second and talking
No, go
about
ahead.
that.
Please talk about it.
Well, this is an amazing center, and this is why I got so inspired by it. Because oftentimes we're given the opportunity of helping others, and there's organizations that are really outstanding. American Cancer Society. There's all kinds of organizations. What I loved about Kids Cancer Foundation is it's local. You can literally see these families. You can interact with the kids. You can actually see what they're suffering with.
Do you sponsor the kids? Like, is there a way,
Yeah,
people
absolutely.
sponsor a child somewhere else in a
you
starving
can.
country?
Yeah, you can help in many different ways. And Michelle O'Boyle, she's who founded it. She's a nurse practitioner who runs this place and brilliantly runs. There's a lot of hardworking people and nurses that work there. And what's really nice is that they help the families, not just the patient. But when families are dealing with patients whose kids have cancer, there's a lot of sacrifice involved.
And a lot of they have to pay for things, right? Like
And they
hotels
have to pay for
and
things,
hospitals.
hotels, hospitals, schools,
Yeah.
and things like that, teachers. And so it's nonprofit. So all of the money they get, goes towards helping those families. So we're really passionate towards helping them. And so 100% of the money that is earned on our first day services, 100% gets donated to Kids Cancer Foundation.
I love that.
Yeah, and so we have a new patient special, and so to learn more about that, they can give us a call, or they can go on our website, and we'll get them set up. Yeah.
Breast Cancer Awareness Month is coming up.
Yeah, it is.
This month. So
I know, my
that'll
mom
be
died
very
of breast
important
cancer.
for people.
Yeah,
So
it's
did
something
mine.
that's really near and dear to my heart. Yeah.
And I'm a survivor, 7 years.
Wow, congratulations.
So, thank you.
It's amazing.
Think about it every day.
Wow.
I'm very grateful.
Yeah.
So what do you see for the future for your business, for being a chiropractor? What kind of future
I see a
plans?
lot of really wonderful things happening. I do see our office building and growing, and we are spreading chiropractic to our community. I would like to help more people. I would like to grow more practices. I would really like to help more chiropractic students. You know, coming out of school, I know the struggles in school. It's a head trip. You know, you have so many different moving parts and philosophies and people influencing you to go this way and that way. I have a successful practice that helps people the right way. And
How do you
I
help
like to
them?
inspire people. I help inspire students, and I see us growing our practice by having students come and seeing how we do it and branching our practice out.
So when the students come, do they watch an actual session?
Yeah, I just had somebody from Life College University join me on Wednesday. That was really awesome. Yesterday, actually. And yeah, they're just inspired. They see things actually live happening. I mean, we could talk about, you know, your vertigo, for example, but when they actually see it happen right there in front of them, and they see the possibilities of it being able to be provided by them, they get inspired.
How did you get rid of the vertigo? I have to ask, because you told me and I forgot, and it's a great story.
Yeah. Well, do you mind? You don't mind
Nope.
if I tell them?
Tell them, please.
Okay, so with you, all right, there's several different joints in your upper cervical region that's really being affected. All right, one of them is your atlas. All right, that's C1. That's the very first vertebrae, and it's way up underneath your skull. If you feel the bone right behind your ear,
Yes.
okay, that's called your occiput. Just beneath it is you can consider it kind of like the handlebars to your vertebrae. All right, that's called the transverse process. That's where C1 is. And your C1, I forget which direction it was, but that was shifted and stuck to one side. And I determined that when I flexed your head down and I was able to turn your head right and left.
I remember that.
And it wasn't even, right?
Yeah.
There was one side more stuck than the other. And you also had one of your muscles that was weak. And that weakness is indicating nerve interference to that muscle group. And so that can cause shoulder problems, which sounds familiar to you, I'm sure.
Everything builds on everything
It
else,
does.
literally.
Yes, cause and effect. And pain is always the last thing that shows. People have to understand, they think that, oh, I don't need a chiropractor because I don't feel any pain. But segmental dysfunction happens way before the pain starts. And so does disease, right? You know that to be true with people that, have heart attacks and high cholesterol. Symptoms are always the last thing that appear. Going back to your question, so evaluation is key. Evaluating exactly what malposition we're dealing with, what motion restriction we're dealing with, and then prescribing the right application is paramount.
And then you know what to focus on when they come in for their visit. So if people want to come in for a visit anytime soon, are there any specials coming up or anything you'd like to talk about?
Well, we do have some coming up. Thanksgiving's coming up and Christmas is coming up. I haven't settled it with my team yet, but we definitely have some new patient specials coming up. So all they have to do is go on our website, give us a call. We'll get them set up.
And the website again is what?
It's maxhealthchiropractic.com.
Are you on any social media?
Yeah, Facebook, Instagram.
Okay. And if they go on social media, can they see you in action? Like, can they actually watch?
We're actually going to be starting something really soon. So yeah, we're going
to. Like a podcast?
Maybe, we'll see. But yeah, we're going to be launching some social media content really soon. So yeah, you're going to see some really good stuff.
I hope that the next time you come on, and I know you'll come on again, you can tell us more about the laser therapy, because that was intriguing to me.
Yeah, we do a lot of different we have a lot of different technology in our office: laser, shockwave, spinal decompression. One of the new things we started adding was stretch therapy.
That's right. And I never got to come for my stretch because every time I was supposed to come, something happened.
Oh man,
They waited too much to come. I still need to come for that.
Yeah, it's wonderful.
And the people that do it are very skilled. I've watched them work on people. And it's great, especially if you dance.
Yeah.
Like you work with the dancers, right? At Fred Astaire.
Yep, Fred Astaire.
All the time. Yeah. You get them right back to normal.
Yeah, we work with many different types of athletes, CrossFit athletes, polo, equestrians, ballroom dancers, like you said. Yeah. Little babies, old ladies, and everyone in between.
I like that. We'll have to put that in the commercial.
There you go.
So, you've heard it straight from Max, Dr. Max. Come to Dr. Max's practice. Learn more about how to help yourself and how to help others. And I believe that the first visit is a consultation, correct?
Consultation, evaluation, x-rays. Sometimes we treat, sometimes we don't. It just depends on what's presenting.
And then you would tell people how many times you think that they should come back, or what would
we'll
work
have
for
a
them.
plan, and that's individually based on what they need. Yep.
Okay. Well, I will be coming more often. especially because I know when stress builds up, then you have problems in all areas of your body.
I'm here to help
and
you.
And you're a wonderful doctor, Dr. Max.
Oh, thank you.
And we will be looking for more from you. We'll be looking into the specials. People will be following you. And I thank you so much for coming on the show.
Thank you,
It was
Denise, for
wonderful.
having me. I appreciate
and
it.
And the next time you come, I know you're going to bring Jen, your
Yeah.
wife, Jen.
Okay,
yes.
yep, I'll bring Jen.
And maybe
I
even
could
the
do like a
kids.
demo or something.
Yes, we would love
Cool.
that.
All
Thank
right.
you so much for coming.
Thank you. I appreciate you.
Thank you. You have a great day.
You too.
Thanks. Bye, everyone. See you in 2 Thursdays. Have a good one.
Thank you for tuning in to Gypsy Soul. Make sure to stop by next time for another enlightening show. A show that was produced by Ant Media Productions and hosted by Denise Marsh.